Hello, everyone. My name is Joe Whittington, Director of Business Development at Universal Language Service, and I'd like to welcome you to our ongoing training sessions. Today's topic will be how to use telephonic interpretation. Again, thank you for being a customer, and as usual, please contact us at any time for immediate support as your needs evolve and change over time. I like to kick off all meetings with an industry story. We support 8 of the 10 largest hospital systems on the West Coast. We provide on-site, over the phone, video remote, translation, localization, interpreter, assessment testing, and proficiency testing to both our interpreters and for our customers. During COVID-19, our interpreters were the first responders. After hospital staff, our interpreters were the first to rush in to provide critical support. They observed all PPE guidelines, and they experienced a disproportionate amount of highly catastrophic health events to themselves and their families. I believe this reflects the risk interpreters encounter. Nationally, 1 in 5 families speak a language other than English at home, and is believed to have, for them to have lesser access to healthcare information and treatment. We are working to improve this information and healthcare disparity for our interpreters. On the reverse side, hospitals cited better healthcare results due to our interpreters. A director of nursing stated that physicians are happier. Of course, I responded with, well, they should be happier. We provide 80 hours training, quality monitoring, criminal history background check, non-disclosure agreements, HIPAA compliance sign-off, ADA familiarity, Section 1557 of the Affordable Care Act. All the federal regulatory guidelines are briefed and trained. Our interpreters know these things, but the director of nursing said our physicians are happier because healthcare exams are taking less time. They're getting better medical results. They're prescribing less tests. They're having better medical outcomes because of the knowledge, the skills, the abilities of our interpreters. So I'm very proud of that comment, that exchange, and that statistic. So I'm briefing all new customers on that success. It's a major success for Universal Language Service. For telephonic interpretation, we support over 200 languages with easy to access and use services 24 hours a day. It's as simple as dialing a toll-free number, entering your dedicated account code, selecting a language, and starting your meeting. Let's discuss the typical ways to access telephonic interpreters, starting with supporting an inbound call. Say to your customer, please hold for an interpreter. Place your LEP customer or patient on hold. LEP is a standard industry term for limited English proficiency. And in this case, indicating your patient may have limited English proficient skill sets. Dial the provided toll-free number, follow the IVR prompts, enter your account code, select a language, and the interpreter will quickly join the line. Give the interpreter any key instructions that you need to accomplish during that call. Add the LEP caller to the line using your 3-way button or conference button to begin the call. Say, end the call to the interpreter to complete the call. So we know and everyone knows that all questions are answered. Say complete the call and everyone disengages. Next, supporting a face-to-face meeting. Similar to the above, say please hold for an interpreter. To the customer that's in your lobby or in your exam room or anywhere, dial in the account code, dial in your provided number, enter account code, select a language, summarize any key requirements to the interpreter, place the interpreter on speakerphone, or pass the handset back and forth to begin the call. Please ask us about dual handset phones or line splitters that may facilitate easier use of face-to-face meetings using an audio interpreter, and the call as usual. Next, accessing an interpreter for a third-party dial. Dial in as usual, request language needed, or zero out for a waiting call center agent. The agent will connect you to the requested interpreter or assist you through the process. Direct the interpreter to dial the phone number anywhere in the United States to reach the LEP you need to reach. Your meeting will begin when the LEP joins joins the line. Again, end the call as usual. Next, and probably the most important connection during a pandemic and in the post-COVID environment is adding an interpreter to a Teams, Zoom, and other major web-based platform meetings, anything under the telehealth, teleweb umbrella. Using the prior methods with the customer, the interpreter on the line, dial into your audio portion of your web call, or more typically, Universal Language sends the web invite to our interpreter with login instructions, or sends the customer the link to the interpreter to log in, like any other meeting participants. Or the customer can provide us a link to distribute to the interpreter, or again, we provide the link to interpreter to distribute to your patient. Everyone is going to access the same link, but the interpreter will be waiting. Let's discuss Agent Assistant. Always press 0 to be connected to a waiting call center agent when you have questions, or in these scenarios, when you cannot determine the language required or the language code, or to simply walk you through the process. The waiting call center agent is there to assist you. Let's also address the consistent call flow you can expect each time you call a Universal Language Service telephonic interpreter. The interpreter provides their name and ID number. Jot this down for future reference. Everything said will be interpreted to the LEP, and LEP comments will be interpreted to you. All information will be kept highly confidential. Indicate when you are ready to end the call. End the call after questions are answered, and disconnect to disconnect all parties. Let's wrap up today's session there. Again, thank you for being a current customer, or please contact us for any services information that you may require. And we look forward to earning your business if you're not a current customer. Thank you very much. Let's check for any questions. And I believe we're at our time. Let's go ahead and end the call there. Thank you.